legal aspects of disclosing medical errors, the patient and family, like any of us, we want to know what's happening. We would like to seek a second opinion and also collaborate in, the plan of care of our relative. But how much do we disclose when a medical error occurs? And how effectively can we tell our healthcare professionals how to handle this sensitive area of communication? Over to you, Captain Ajitha.
Thank you, Dr. Lulu, for that question, and thank you, Kaha, for this wonderful opportunity. And definitely a not so easy topic to talk about. Well, disclosure of medical errors is a purposeful communication between the healthcare provider and the patient, where we acknowledge the occurrence of a medical error and the possible consequences and the relationship between the occurrence and the unfavorable outcome in most situations. Of course, we do have instances where this medical error hasn't resulted in any untoward outcome. There it is probably easier, or we can keep quiet about it because the patient hasn't really experienced it so far. But the hell break loose when things go wrong because of a medical error, and even worse when the patient party is aware of it. Then we are really caught that to tell or not to tell. If we tell, it is a problem. If we don't tell, it's another problem. So the situation is very murky, actually speaking. So we cannot, in fact, leave it to the healthcare worker to decide whether to tell or not. Better to have an institutional policy. I wonder how many of us working in institutions do have an institutional support regarding this institutional policy as to who should be disclosing it, whether the person who committed the error should disclose or someone else should tell. Should the person who made the error should be there while disclosing, and whom to disclose, and who all should attend and should be apologize and admit the error. I mean, all these are today's in most of the situation in hospitals, it is left to the healthcare worker. And many times we feel so cornered and helpless when we have to decide whether to disclose it to the patient, especially the one who committed it. And it is a huge stress on the healthcare worker, and it sometimes may affect them so adversely. So just to share with you 2 examples of what I have come across. I mean, not many are there, but of course, 2 of it where in one, a healthcare worker, a nurse, inadvertently gives a muscle relaxant to a patient who was waiting for discharge for the next day, and unfortunately the patient dies. And to our luck, it happened, I don't know whether to write to say that way or not, it was just after half an hour of the visiting hours. During the visiting hour, they were there. And this was one of the most difficult situations I have come across as head of the Department of Nursing. One of my nurses did this. And the second instance is where a Ryle's tube feed, which was supposed to go to the stomach, was given in an intravenous line, in a central line. So that was the next event. So I'm taking this both as an example of the first case. Now, who decides whether to disclose it to the relative or not? In the first case, obviously the patient died. And in this case, it was the head of the hospital who took the decision. In fact, not the consultant, but the one who was heading the hospital. And because it was at around 9 o'clock in the night, I had to go and handle this situation because it was only MOD who was there on duty at that time. So the head of the institution decided not to disclose it to the patient. And there was no patient relative, and it was shown as something else. A cardiac arrest of the patient. And I'm sure most of the cases, it happens this way, right? In most of the instances, what we come across. But well, it was not disclosed to the patient, so we did not have issues from their side, except counseling them for an untimely death or unexpected death. But what most difficult for me was to handle the doctor who inadvertently has transcribed an order which was actually written in the medical ICU before ventilating the patient. So when the patient was brought to the step down area. Another duty doctor wrote this prescription, and a nurse carried out. Probably both of them did not know the action of the drug. And handling them was the most difficult situation for me, where they were, utterly shocked. And, one of them later said that I killed a person, so to that level. And in the case of the nurse, I had to give her, leave, refer her to psychiatrist. She went into acute depression, and handling this part of it becomes very, very difficult. But I'm thankful and learned a big lesson from that organization, that they had a written policy not to punish anyone for a genuine mistake. That was a big lesson for me. This happened in the initial years of my service in private sector. And couldn't imagine that there is a policy like this, where it was obviously an error and not acceptable thing from a healthcare worker, of course, that not knowing the action of the injection before giving it. But however, we held on to the policy, and all those who were involved were not punished but supported, and that was a big experience, a moving experience, I would say. And in the second example, which I said, was in the same hospital, but the consultant, though this again, this trials to feed was given in a central line by another nurse, of course. But in this case, the consultant doctor decided to disclose it to the patient in the same hospital. Okay, so and he did not, in fact, I don't think he has discussed it with the head of the hospital. In any case, he said, I take the responsibility. Okay, and I was there when this disclosure was done. And that was another moving experience, where the consultant, it was a surgical case, and the consultant surgeon holding the hands of the patient relative and begging them sorry that it happened from our side. He did not say who did this. Though there was no written hospital policy per se for this, but I do respect that person a lot. And then I later asked, what gave you the courage to go and disclose it to the patient? So what he was saying is that he did discuss this incident with the son of the patient, who is settled in US. Matter became easier then, because in Western countries, probably it is a talk. It's a lot more discussed. Public is involved in these kind of discussions, and they are a lot more open to such kind of disclosures, or maybe the truth. Here in our country, as everyone knows, we are trained from our childhood not to disclose things and hide our emotions and the truth. So this has a lot of cultural bearing as well. I feel like we have been brought up not only in medical field, but from childhood we have been brought up not to speak truth, so that hoping that we can avoid a unfavorable situation, or a skirmish, or some kind of a problem. So we have been all probably influenced by our past experiences, and a lot of similar instances where the patients were affected, or in some cases not. Some cases we do disclose, because when usually what happens is, when we don't have a choice, we do disclose, right? Because the patient has anyway come to know about it, and go and ask, beg their mercy to be sorry. But today's situation, the patient really demands an apology, and not only an apology, but they feel they have the right to know what has been done from our side, not to repeat it. This is a common language which I hear from the patients, that yes, whatever has happened is happened, and what next? How do you ensure that like us, another patient doesn't suffer? This is their typical question to us. It is very difficult to deal with them, but I feel over a period of time dealing with them, if there is an error, disclosure happens, usually I volunteer and be there in the team, because I feel just by your presence, the people affected have some kind of a moral courage, because it is difficult to and difficult to face them, especially if they are violent. Yes, some of them are really violent, and it is very difficult to deal with them at that time. But however, every institution, I feel, should have a policy, and according to the policy, and if the policy has to be changed or anything, somebody can take a call on that. But a system of accountability has to be there. But at the same time, how do we communicate that we are a truthful organization and bearing high quality healthcare? Truth telling is, in the Western world, it is accepted as a sign of high quality healthcare. But as all of us know, that we are long way behind it. But however, we have to have two sides to it. One is disclosing to the patient and supporting the involved healthcare worker.
Thank you for sharing your experience and bringing about two valid points, ma'am. Pen and paper written policy on how to effectively disclose, and at the same time giving support to the healthcare worker.